Mupirocin is a type of antibiotic that is used to treat specific skin infections, such as impetigo. It works by stopping the growth of certain bacteria in the affected area. This medication is typically applied to the skin and should be used as directed by your healthcare provider. Use it at the same time each day for the best results. Make sure to follow the instructions on the packaging and consult a healthcare professional if you have any questions or concerns. Before you start using the Whytederm Surgipak kit, make sure to read the patient information leaflet from your pharmacist. Clean and dry the affected area before applying a small amount of ointment as directed by your doctor, usually 3 times a day. You can cover the area with a bandage. Use the medication regularly for the full time prescribed, even if symptoms disappear. Avoid using it around your eyes, nose, mouth, or on large areas of damaged skin unless directed by your doctor. If it gets in your eyes, nose, or mouth, rinse well with water. If your condition does not improve in 3 to 5 days, consult your doctor. When using the Whytederm Surgipak kit, it's important to remember that your doctor has prescribed it because they believe the benefits outweigh the potential side effects. While many people don't experience serious side effects, some may notice mild burning or stinging after use. If you experience severe burning, stinging, or irritation, it's important to stop using the medication and contact your doctor immediately. In rare cases, this medication may lead to a severe intestinal condition caused by a bacteria called C. difficile. If you develop persistent diarrhea, abdominal pain, or notice blood in your stool, it's important to seek medical attention right away. Avoid using anti-diarrhea or opioid products if you experience these symptoms, as they may worsen the condition. Prolonged or repeated use of this medication may lead to a new skin infection caused by fungus or yeast. If you notice signs of a new infection or if your current infection does not improve, contact your doctor. While very rare, a serious allergic reaction to this drug is possible. Seek medical help immediately if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you experience any other effects, it's best to contact your doctor or pharmacist. If you're in the US, you can report side effects to the FDA, and in Canada, you can report them to Health Canada. Before using Whytederm Surgipak kit, it is important to inform your doctor or pharmacist about any allergies you may have. This product may contain inactive ingredients that could cause allergic reactions, so it's essential to discuss this with your pharmacist. Also, be sure to inform your doctor or pharmacist about your medical history, especially if you have kidney disease, as this information is crucial before using this medication. If you are planning to have surgery, it's important to let your doctor or dentist know about all the medications and products you are currently using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, it's important to discuss the risks and benefits of using this medication with your doctor, as it should only be used when clearly needed during pregnancy. It's also important to consult your doctor before using this medication if you are breastfeeding, as it is unknown if this drug passes into breast milk. It's important to be aware that using this medication with other drugs may affect how it works or increase the risk of serious side effects. To ensure your safety, keep a list of all the products you are using, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. If this medication is ingested, it can be dangerous. If an individual has taken too much and is experiencing severe symptoms such as fainting or difficulty breathing, it is important to seek immediate medical attention by calling 911. Otherwise, contact a poison control center right away. In the United States, residents can reach out to their local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center for assistance. It's important not to share the Whytederm Surgipak kit with others. This medication is prescribed specifically for your current condition, so it's crucial not to use it for another infection unless directed by your doctor. If you forget to take a dose of Whytederm Surgipak kit, take it as soon as you remember. If it's almost time for your next dose, skip the missed dose and take the next one at your regular time. Do not take a double dose to make up for the missed one. It's important to stick to your regular dosing schedule for the best results. It's important to store the Surgipak kit at room temperature and to keep it away from children and pets. Do not flush the medications down the toilet or pour them into a drain unless instructed to do so. When the product is expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.